Welcome to Tea Time, my friends, a place where I muse about my gender transition experience and in the process aim to comfort and inspire others to a greater level of self awareness. I am Artemis, on this episode enjoying a cup of dark cocoa rose petit four tea, courtesy of the Rose and Vine Gift Company. And in this video, I'm going to make the claim that we are approaching transgender medicine completely backwards and offer up a tough solution within my scope of reference. Granted, with how little we understand about transgenderism and its spectrum of motivations, experiences, and expressions between biological males and females, it suffices to say that there really isn't a one-size-fits-all treatment. However, the general course of medical treatment in society today in the United States is one that I believe will cause far more collateral damage than solution, even if the intentions are well, and I'm going to outline an alternative. And while it could take me some time to introduce all the nuanced expressions of transgenderism, it would be easier for me to just start by drastically simplifying a definition, at least for the purposes of this video. Basically, transgenderism is when an individual takes steps to modify themselves to any degree in order to express a gender that is opposite to what would be expected for their sex, usually due to a discomfort of sorts with their physical bodies. And a side note, people who just dress atypical for their sex are not transgender. This is just cross-dressing. There must be some medical intervention involved, whether that is hormones or surgery. And as I said before, the motivations, psychological beliefs, expressions, manifestations, onsets, and experiences will vary widely in transgenderism, but the core is always the same: medical intervention of some kind to appear opposite their birth sex. And if you're looking for a more professionally sanctioned definition of transgender, there isn't one, to my knowledge. The DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, doesn't have any entry for that term specifically, and instead focuses more on the hallmark of transgender people with the term gender identity disorder, although recently this has been changed to gender dysphoria. And I'm not even going to touch in this video why the term was changed, but it's crucially important to note that there doesn't seem to be a single definition of the experience of transgender, and that will play into why I feel we are approaching transgender medicine backwards. I have another video that I am linking above that talks more about the spectrum of transgender experience, but with this limited definition laid out as our foundation, let's just get into the gearbox of this medical maze. To understand where we are, we have to look at where we have been and what the starting premises are for the solutions being enacted. We've had the better part of the last century more aggressively trying to quote-unquote treat people with symptoms classified as transgenderism, even though people who don't fit the gender norm paradigm have been around since ancient times. What strikes me immediately, though, as kind of sad is the fact that while there are people who exist that really would want to make varying degrees of sex changes to themselves just for the sake of their own enjoyment, many have sought to make more changes than would have been sufficient due to the lack of acceptance or even criminalizing of a middle ground, someone who can exhibit atypical characteristics for their sex, like no breasts on a woman or just plain bisexuality. The issue is made to be black and white. Either you are a man or a woman and align with all the check marks, or there is something wrong with you that further needs connected, and that's tragic in my opinion. While there may be some presentations of gender dysphoria that are a mental health disturbance that needs attention, in general, the spectrum of expression between the two far ends of female and male is something that, in my opinion, should be celebrated and not pathologized. But our society, for the most part, has chosen to do the latter, and there have been two pathways used to treat people experiencing persistent sex-related discomfort with their bodies. One was that if the problem stems from the mind, then psychotherapy would be used to treat it in order to align the mind with the body. For some people whose gender discomfort stems from deeply rooted cognitive biases learned in childhood, for example, a young boy raised by a misandric parent, this kind of therapy works for them. However, I would personally argue that this sort of person doesn't qualify as transgender because their gender dysphoria is learned and also not served in a long term way by medical intervention. And here we have also immediately uncovered why therapy before irreversible treatments are performed is absolutely crucial. What is being mistaken for transgender is an individual just needing corrective counseling. There are individuals for whom this type of psychotherapy does not work, and therefore are the reason the next pathway we will discuss was proposed. But it seems the medical community has thrown the baby out with the bathwater and discounted the gatekeeping necessity of sorting from the roots of people's dysphorias. The current political climate is one where, for the sake of being validating and inclusive, we are ushering in hundreds or thousands of children to varying degrees of future detransitioning hell, simply because for some people, psychotherapy has not worked. And for those that psychotherapy has not worked, the second pathway has come into more popularity, which is to try to align the body with the mind by making surgical and hormonal changes. The foundation for this line of thinking stems from the belief that someone could indeed be born, quote unquote, in the wrong body, so to speak, and that with enough surgical intervention, you can change someone's sex. And while this can never be true, the degree to which this form of therapy can actually be helpful is really aimed at a very, very small fraction of the population and should be avoided as often as possible until all other avenues have been investigated due to its permanent nature. It is truly a mental health disorder for someone to thoroughly believe that they were born in the wrong body. And I mean absolutely no disrespect by saying this, because while we know from neurological studies that men and women access parts of their brain differently from one another, there is no such thing as a male brain or a female brain. Therefore, even if you define you as your consciousness that resides in between your ears, you/your brain cannot be born in the wrong body. Instead, it's simply a matter of disorder, which, don't get me wrong, still sucks. And since society today is really uptight about political correctness and being offended, let me disclaim that there is nothing inherently insulting about pointing out that someone is not in order. That's just what a disorder is. And I'm not indicating that someone is somehow inferior with that language. Check out my video links above if you want more on that ninja level mental zen. Anyway, the dangers of applying this type of therapy, rushing to alter the body, to the population at large is that there will be far more collateral damage to the people for whom this therapy is hastily performed on, perhaps simply because it is an industry for which disgusting amounts of cash can be made, and we are seeing it in the massive numbers of people who have come forward admitting their regret and are in the process of detransitioning. Furthermore, this therapy is being unleashed on children, a part of the demographic that should never be subject to this type of therapy for a multitude of reasons, not the least of which is that gender confusion is normal for the age and they very often outgrow it, and that our brains are neurologically proven not mature enough to make those kinds of life-altering decisions. At this moment in time, we have no way of separating out the child who would benefit from early medical transitioning from the vast majority of kids who say that they want it. So this sadly means that the best course of action for the benefit of many is to wait until the brain is more mature before greenlighting heavy medical treatment to help a very tiny percentage. And this is a tough reality. Even as adults, the trans mantra of I know myself and what I want, so I should be allowed to do whatever I need to feel better about myself, has an inherent conundrum that we can readily demonstrate. Because if such a claim were true, that you know yourself and what you need, there would be no such thing as the detransitioner who claims that they thought they were trans and really were not. There would be no such thing as someone who marries another they supposedly love and want to spend the rest of their life with, and then they just fall out of love and get divorced. There would be no such thing as the midlife crisis, where marrying a midget in Vegas after an all-night bender of gambling and drinking your life savings away comes completely out of the blue. Thing is, I do believe that people, read adults, should be allowed to get what they want for themselves if they know that they will be happier in the having of it. But too often, rather than accepting the consequences, come what may, down the line, people will reach out and blame the medical professional. Or you'll have a whole swath of the population that cannot reproduce because of their choice. Which, sure, if you're concerned about the survival of the species, then this is a problem. Then you get intellectual elites and government agencies that assume the parental role of oversight, and you trade freedom for perceived security in authority because you lack the discipline of personal responsibility. But I digress. The running thread to keep in mind through these two pathways of failed treatments that I've gone through is that the underlying belief was that someone could be born in the wrong body. And that's what I want to zero in on as the flawed premise that keeps us from getting transgender medicine right, if we can at all. Now, I feel like I have to note a few points before I dive into the proposed solutions to the title of the video. The first is that if you know anything about the Briggs-Myers scale of personality assessment, I personally scored as an INTJ, which for anyone who doesn't know, that's basically as left-brained, analytical, and logical as you can get before you may as well be mistaken for a computer. And also apparently only accounts for less than 2% of the population, so it isn't lost on me that the way I process things may not be helpful for many people, especially those with motivations that are more social in nature versus personal. That being said, I'm also coming from the female to male transgender experience, which doesn't account for motivations of males to females, possibly encompassing autogynephilia, etc., further potentially limiting the usefulness of my suggestions. Still, however small a niche I may fit, I'm offering up what has helped me in the hopes it can help others. Second, since we are at the frontier of understanding the mechanisms behind what manifests as transgenderism, there is an argument out there that no physical medical intervention is appropriate due to all the risks that come with the treatments available, and it's psychotherapy or bust. For example, the known adverse effects of male levels of testosterone on the female reproductive system, or the horrifying and life-threatening array of complications stemming from vaginoplasty or phalloplasties, are argued not to be worth the benefit they would provide to the transgender individual because we still do not yet fully understand what causes gender dysphoria. Not to mention the current medical and legal argument that severe, crippling gender dysphoria that is at the level of life or death crisis can easily be considered a mental illness, and if someone is mentally ill, they cannot provide informed consent, no matter how vehemently they fight for it. It's a pretty crappy double bind. It's a truly difficult place when you try to weigh the value of free will against the moral system we've attempted to put in place, and I don't think that there is a one-size-fits-all answer. These surgeries are also still very new to the field, and no procedure gets perfected on a cadaver, so the moment it dawns on you that you are the practice, this is another painful awareness to come to and might feel like a rock in a hard place. Worse, on top of all of this, is that there are many medical professionals, not all, of course, who do not fully disclose these dangers to patients and instead are more concerned with the paycheck and the chance to create their own Frankenstein. I mean, really, think about the kind of person it takes to be comfortable slicing and dicing a human body. While many out there are doing heroic work, there's a level of compartmentalizing going on there that would be naive to ignore. It's a hard reality to come to terms with, the fact that not every authority figure out there is in their position to help people, and even less conscious of this danger is the person who is in mental distress and just wants it to stop. All that being said, here is what I have found so far to have worked for me, and I propose it as a potential solution to mitigate these risks that I've just discussed. I happened to stumble across the sequence of treatment steps that I'm about to outline for myself simply by avoiding dealing with my identity until I was an adult. And I say simply very tongue-in-cheek because it was only due to massive self-delusion that I delayed discovering myself until my brain was mature enough to understand what was actually going on. I was a closeted lesbian until I was about 28 years old and had kept myself in a decade-plus long toxic relationship with someone of the opposite sex because I was in supreme denial of who I was. When all of that came crashing down, I went through a sequence of discovering my sexuality, doing therapy to clear up some childhood baggage, and once all of that was clear, the possibility of transitioning remained appealing to me, but not because I actually believed that I was born in the wrong body or needed to be more male on the outside. And so here's what I arrived at. Whether or not you're trans should be approached from the individual aspects of transitioning and whether that is right for you, rather than I want to live as a man or a woman and then trying to recreate the physical aspects of that. You would instead gradually increase the medical complexity until you reach a personally satisfactory point. At each stage, it would be crucial to weigh the importance of the benefits gained against the potential complications and their likelihood. For example, I decided that the benefits of testosterone was worth monitoring for the potential complications and consistently reevaluate the dosage and watch for symptoms in the event that I need to choose differently based on all the factors in my life at my annual checkups. The benefits of top surgery for me also were well worth the potential risks there. I had several risk factors for breast complications before testosterone, like fibrocystic breast disease, so removing my breasts killed two birds with one stone. Any other surgeries for me are absolutely not worth it. I would think that the level of dysphoria must be so great for someone wanting more procedures that without performing the surgery and with no other successful options, their quality of life couldn't get any worse if they tried it, so why not go for it? And I can understand that. The catch there is that many surgeons will downplay the complications and make the procedures seem simple, and this will encourage medical intervention that in the end does more harm than good when the common complications arise. I've seen the story many times of transgender people saying, if only I knew how bad this could have been, it wouldn't have been worth it for me. And that's a terrible situation. I'm only advocating here for people to weigh these options very carefully for themselves, taking a hard look at potential consequences and really coming to terms with them without placing blind trust in authoritative figures. Ultimately, though, the changes on hormone replacement therapy and surgeries are still superficial markers and don't define a man or a woman in their totality very well. And I mean, what is a man or a woman? I mean, sure, you can define it by its parts, but it completely misses all the nuance that we've built as social constructs and not things that can be duplicated within yourself. Things like stereotypes, social motivations, and gender roles. Plus, just as social constructs of man and woman shift throughout time, you wouldn't want an irreversible decision to be made based on those things. The biggest thing that I have worked out is that there is no definition for man and woman other than the literal biological definition, which a transgender person can never achieve anyway. What I think people often conflate, making this even more complicated, is what it means to be masculine or feminine with male and female. And then trying to say that to be a man, you must be such and such masculine characteristics. And to be a woman, you must be the such and such feminine characteristics. This also throws feminine men and masculine women under the bus as somehow unfit for their sex, which, in my opinion, is a shame, and might even be the reason some people incorrectly try to transition because they are trying to align a biological sex with traditional traits associated with that sex. What we would actually label as simply masculine or feminine, terms that can be completely divorced from their association with biological sex. Sure, masculine characteristics are generally associated with men, and feminine characteristics are generally associated with women. But for a truly maximized society, this cannot be the strict binary followed. Trans people are just a highly visible example of how the overlap between the two can occur, and it's unfortunate that there is a lot of association with mental health issues within the transgender community, which is serving to delegitimize the argument that there is flow between the two that can be healthy. So, here's what I mean by approaching the question of transitioning from individual aspects, and I'll use questions that I asked myself. First question, will you be alright with the short-term, potentially irreversible changes to your body caused by a trial period of testosterone or estrogen, to see if either are a good therapy as a supplemental medication and then potentially continue for life? Yes or no? Would being rid of your breasts or adding breasts be a body modification in and of itself that you would enjoy, minus the social feedback? Yes or no? If you end up making enough choices that you would then be perceived as the opposite sex, then it's time to consider what social implications this will have for you and how you will deal with or integrate into society, not the other way around like so many people have been looking at it, i.e., I want to be a man or a woman. Another way to look at this murky territory is what Jordan Peterson has been saying of the non-binary label when he asks, what are you going to do with that identity? Because society treats men and women differently, and the motivation for that is wired at the biological level. So despite a greater societal acceptance of gender non-conforming people, you will still experience disharmony as other people react to you during your transition, and especially if you aim to inhabit the androgynous territory in perpetuity. You have to be prepared for the soup of responses, something that a passible or conforming person doesn't have to contend with and often takes for granted, and brings us back to the point I made about people feeling the need to make a complete and total transition even if it isn't best for them, because the middle ground just isn't as societally accepted, and they're made to feel like it must then be wrong. This is much of what happens to children, and perhaps why they feel that they must be strictly one or the other, pushing them to medical intervention if they're made aware of it, because we seem to insist on a strict dichotomy of men must be masculine and women must be feminine, and we suffer as a society for that. As people, we fail to understand 2 points of our evolutionary biology, both that we're wired to value only gender-conforming individuals because they can reproduce, and that children are wired to seek acceptance of their peers and parents. Children externalize this problem of gender confusion into physical attributes to fix or change when the vast majority of them do not need it, instead of just accepting the natural range of gender expressions because their adult influences are supporting their exploration. And no, this does not mean that I support teaching sex ed or kink or anything else of that nature to children. There's a huge difference between giving kids a controlled and safe space to ask questions that they're ready for and supporting that exploration and dumping tons of sexually advanced concepts into impressionable minds. At any rate, people living in the gray areas of gender expression aren't prepared for the feedback loop that they get when they interact with the wider society, which is understandable for humans as social creatures. So unless you get a handle on this, it will handle you. I've also done a video about the social and psychological considerations for people transitioning, which is an aspect many people are not prepared for and instead are only informed of the physical changes they will experience, leaving them half-cocked for the ride ahead. So check out the link above for more of my thoughts on that. The last thing I'll leave you to consider lends more support for a nuanced treatment of the experience of transgenderism. This is the possibility that while our brains cannot be of one sex or the other, there may be merit behind the idea that while someone can be born with specific genitalia, there may be certain physiological aspects about them that operate like the opposite sex. Some people are calling this a chimera model to resemble the mythological creature made up of the different parts of different species of animals. And while it doesn't have to be that drastically noticeable for transgenderism, for example, someone like myself born as a female has certain chemical pathways programmed within the body that actually respond favorably in noticeable mental health or other physical ways to biologically male levels of testosterone. I did a video about this on the unexpected effect that testosterone had on me, link above, and it cannot be explained away with the short-term positive mental health effects that testosterone is known to have. Plus, I never had mental health disorders prior to taking it that could have been improved with its use. Perhaps someday science will catch up with this to provide more understanding, but for now, I think a good start would be simply for us to stop chasing the idea of being something we can never actually be, and start exploring the infinite range of expression of gender within the sex binary in a way that is healthy at the level of each unique individual.